How you doing, Dr. Ulysses Jackson? Welcome back to another Mental Health Monday, where today we're going to discuss the importance of managing anxiety. How do you manage your anxiety? Do you manage your anxiety through SR medications? Do you manage your anxiety based on going to a doctor or psychiatrist? What ways and what approaches do you use dealing with your anxiety? Today, that's what we're going to discuss today. Managing anxiety on Mental Health Monday with Dr. Ulysses Jackson. Sometimes what happens when we manage our anxiety, we can go to a doctor, an MD, psychiatrist, psych MD, to get medication, to say, doc, I'm so anxious, I'm gonna need some medication. And to get that medication, it may be the form for you. Others choose to use cognitive behavioral therapy, which is an approach in which you find out what are the triggers that trigger you to have anxiety. It can be a relationship, it could be finances, it could be money, it could be job satisfaction. So the first step in using cognitive behavior therapy is to find out what is the trigger that causes this anxiety. And I have to say and mention for a disclaimer, please do not take anything that I'm saying as replacement for therapy. What we're gonna do is we're gonna look at this as an informational discussion on how we're going to deal with our anxiety. And the first thing to do, we have to find out what are the levels of anxiety that you have. Are you at a level where you get so anxious about a test or presentation that you literally have to pull over because you're going into a panic attack? Is your anxiety so extreme that you can't leave the house? So we have to find out what anxious behaviors you have. Agoraphobia, social anxiety, generalized anxiety. What form of anxiety do you have? And then we're going to find an approach to deal with it. We're going to come up with some interventions and some prevention methods to deal with this anxiety. So that's the first step that we have to deal with. How do we manage anxiety once we've identified anxiety? My approach, an approach that works for me and my practice, has been cognitive behavioral therapy, which is we're going to get to the root of what causes your anxiety. Is it, something extreme has happened in your life? Have you always just been an anxious person? Is it seasonal? So the first thing when you deal with managing anxiety is find out which anxiety it is. And the DSM-5 has over 7 anxieties listed, from agoraphobia to social anxiety to phobias of snakes, phobias of height, these type of phobias. So again, this is Dr. Ulysses Jackson, and some people may just say, hey, I'm anxious, or I've been anxious all the time. Where does that anxiety come from? What's going on with you? Those are the first things to find out where this is coming from. So how do you manage your anxiety? Today's discussion, real quick, we're going to discuss it on how we're going to deal with this anxiety. And it's to find out what it is, identify it, and then find some triggers, some intervention, and some prevention for this. The reason I give you all these short skits is that you may say, hey, I'm anxious and I'm going to take medication. Hey, I'm anxious because, I had a test today, I went back to school. Or I'm anxious because my bills are due and I got to also buy my kids some school clothes and I don't have any money. And it's causing me to have extreme anxiety. So the first thing is find out what this anxiety is and what it isn't. Dr. Ulysses Jackson, managing social anxiety.